I'm going to start with you, my man. Do we see eye to eye on this, or do you want to see something pass Obamacare repeal immediately?
By the way, is it no tie day on here? I just noticed.
It's no tie day for every day.
It's always no tie day for Eric Bowler.
You think I like wearing this? Anyway, I'll tell you why I disagree with you. First of all, why do we keep arguing about health care in the context of what the left argues? Let's say they repeal it, and they give them 12 months advance notice. What do you think is going to happen? Insurance companies are going to create policies for 20 million people. There will be new insurance companies that are created. You think they're going to leave that money on the table? 20 million people are going to be in the streets and die in this country? It'll never happen. We're a nation of entrepreneurs. That's number one. Number two, putting it off isn't going to fix it. You think they're going to just easily be able to slash taxes? That's not going to happen. Infrastructure.
Well, why not, Mark?
Yeah.
Why not?
Because the left doesn't believe in slashing taxes.
But if you combine infrastructure with tax reform,
well, why
where
would
the left likes one and the right likes the other.
And why do you need the left, Mark, when there's a Republican-controlled House?
Well, it's a good question,
Senate,
isn't it? Yeah, well, unfortunately, there's some of the left in the Republican Party. But to answer your question on the infrastructure issue, so in other words, we should spend $1 trillion on infrastructure. I oppose that, too. So in other words, how about we take the agenda that conservatives claim they support, open up the health care system, explain to the American people we have to get rid of Obamacare and Obamacare Light, or we're going to have waiting periods, we're going to have rationing, and people with pre-existing conditions and senior citizens, they're the ones who are going to be hurt. I happen to agree with Rand Paul on that.
I agree, because I think that the problem is that now there's this idea that if something's not being done by the government, it can't be done any other way. And the conservative point of view is always supposed to be that that's not the truth. But like you said, a lot of people have gotten away from that.
And what do you think, Mr. O'Hara? Do you think they get this done if they separate repeal and replace into two? They may get two losses.
Well, first off, Eric, I just want to thank you for introducing Mark first, because it was like the Rolling Stones and this.
Oh, no, I don't think so.
But no, going back to the point, I kind of echoing, I think I definitely speak more for that moderate voice. I don't think you can repeal something without telling the American people what you're going to do next. It's like we have a giant hole in the boat. The ACA is our patch. You know what? Pull that patch. We'll get to it later. It will sink.
Can I answer that?
Please. That's why you're here, Mr. Levin.
The answer is not more government. The answer to the American people is, you like liberty?
Yep.
You like to be able to see a doctor you want to see? You want to see more different types of policies that aren't approved by the federal government? We've gotten away in this country from what makes us prosperous and great.
I'm sorry, Ed. Let's play politics for a second. We got 2018 midterm elections looming large, where the Democrats are saying, go ahead, repeal and replace. We hope you do, because we're going to tattoo you with this, because the way you did to us in 2010. Why rushing through this with premiums rising through 2018, as the CBO says, why is that a good thing politically?
Let me play politics with you. Why do the Republicans have a majority in the House and the Senate?
Because of Obamacare.
Because of repeal. Why did they take 1,000 seats?
No.
Hold on now.
They have the majority in the House and the Senate because of Obamacare in 2010.
Listen to me. I was part of the Tea Party. In 2010, we took over the House. 2014, we took over the Senate. It wasn't because we wanted to expand Medicaid. And it wasn't because we wanted to find new government centralized programs in order to replace a government centralized program. If they would get on message, push the Rand Paul idea, open up the economy, people would see what would happen as a result of it.
I think that I'm seeing something very lazy from the conservative, from the GOP. I won't call them conservatives. I'll say the GOP. Because what you're talking about makes sense. Whether you voted for or you didn't, that's the mandate that they were elected on. Instead, what I see is a fish with another name. It's the same exact policy. In fact, in areas I think it's going to be worse for certain parts of the country. And it's not exactly what they were put in the White House for, or the Senate, or the GOP, and so, or the Congress, rather. So I guess this is my question. What about, for those Americans that want to choose their doctor, that want to have health care that they can afford, do that. For those that are dependent for whatever the reason on the government, just something that's catastrophic, it's a very kind of low economic price tag associated with it. And then there's two systems. For those that can opt in and can afford to do something private, they do that. And if you can't, then you have catastrophic care.
Let me bring these guys in. Either one of you, your thoughts on, well, how about this idea? Remove the mandate of Obamacare, keep the infrastructure of Obamacare, and then let that Obamacare be the thing into 2018, and then you work on your GOP health care.
If we pull the mandate, there goes the money, and it's a debt spiral.
Right.
So, I mean...
But you want to know something? It'll be more expensive to the government, right? And you'll hate that.
Agree.
It's bigger government. But at least you don't lose the House and the Senate in 2018.
Okay, but what we have now, talk about lose the House, lose the Senate, we're going to completely lose everything that makes this country great if this goes on this way. Because this bill, they want to pass it right away for political capital, but it has all the same exact issues as Obamacare did. It's potentially even more expensive, and it's conservatives know this because things like paying, hold on, let me finish, paying to insurance companies, they had previously been arguing were illegal according to the Constitution. And this will fail as it is now, and then we'll wind up with single payer.
Eric, the thing that I think needs to be seen in bright, sparkling colors is the ACA was pushed through arrogantly. The American people were told, this is what we're going to do, reconciliation vote, they got it through on a lawyer's trick. And it was grossly unpopular. So rather than try to do it right, the Republicans are doing the exact same thing.
That's the laziness that I'm speaking
Can I tell you guys
about,
something? One of the smartest men I know a while back was saying, here's what we really need to do. We need to tackle the cost of health care, not insurance. And he outlined a list of ideas of tackling the cost of health care. I don't know, putting pricing up there, drug pricing. You know what that guy's name was? Mark Levin.
He was brilliant.
Why didn't the GOP put any of those ideas into this new bill?
Look, I've had it with the GOP. I'm a conservative. I vote Republican because it's not the Democrats. But the Republican Party is a progressive party. The Democrat Party is a radical left party. But that doesn't mean we stop speaking. It doesn't mean we stop going to the American people. I am telling you to answer all your questions. What is out there for people if we take Obamacare away? The world is out there for people. Opportunity, investment, all kinds of things you can't even think about right now. There'll be insurance companies that prop out. Here's my question, everybody here, if I may. Why can't we choose our own health care? Why does the government have to tell us what to choose? These senators, most of whom are knuckleheads, they get to tell me what kind of plan I can have.
And then, by the way, they opt out of whatever care. They opt out of Obamacare.
People think that if the government's not doing it, that we can't do it. Right. I've done so many things today without the government helping me at all, not to brag, and it was totally fine. I'm doing just great.
Well, and that's fine, and that's fair. Myself, I'm the beneficiary, rather, of a Pell Grant. So I do think there are spaces where the government's help in certain areas for certain things.
Right, I'm not.
So I think that Mark's point is well taken. I love the idea of Americans doing for themselves, and for those hopefully smaller and smaller portion that can't, there's something separate.
Well, I don't think anyone's arguing with that.